Welcome to all. Today I am going to explain first aid and principles of first aid. As the name suggests, first aid is the first help or the assistance provided to a person who is either ill or injured before definitive medical care is made available. Responsibility for providing first aid rests primarily with non-medical personnel attending the site. Accidents and medical emergencies are rather quite common in everyday life, and there is yet no indication that their occurrence will decrease in near future. When an emergency arises, usually it is not the doctor but the layperson who happen to attend to such a case first. The victim could be your parents, brothers, sisters, spouse, children, or any relative friends. Because of the wide variety of emergencies common, man may not be able to deal with them in the best possible manner. It is therefore important for a layman to know the proper indication as well as limitations of first aid to help the patient maximally and avoid any uninitial aggravation of injury or illness. Some of the general principles of first aid are: first one, initiativeness. When an accident occurs and one happens to be nearby, if nobody else is provide the first aid, one must take responsibility until someone more capable arrive for help and rescue. Second point, remaining calm. Remaining calm and conducting the first aid work without panic is important, as this generates a sense of confidence in the patient and bystanders. Third point, check breathing. Check the victim is breathing. Breathing can be detected by watching and palpating the chest and abdominal walls movements. Another method is to hold one's palm or face close to the victim's nose or mouth to sense and feel the breath. If the victim is not breathing, then artificial respiration by mouth to mouth breathing should be start immediately and continue for 30 minutes or until one is fully convinced that the victim is dead. Fourth point, check heartbeat. Palpate the chest to ascertain whether the heart is breathing or not. If the heartbeat is not felt, heart massage should be start immediate. Fifth point, check bleeding. Check for any bleeding in victim. If there is any bleeding, take measure to stop it immediately, as the massive loss of blood otherwise endanger the life of the victim. Bleeding can be controlled by applying some pressure over the wound with a piece of clean cloth or dressing, or exerting pressure on the artery over the wound. Sixth point, assess the level of consciousness. It is necessary to assess the victim's level of consciousness by talking to him. The victim must not be made to sit up or stand until one is sure that his injury or ill is small. The head of an unconscious patient or one who is vomiting should be turned to one side so as to prevent aspiration of stomach contents. Aspiration can be obstructed by windpipe and can kill the victim, else it can lead to various respiratory complications. Any foreign bodies blood clots or broken teeth lying inside the oral cavity should be removed properly so as to keep the passage open for breathing. Seventh point, refrain from giving liquid or food. The first aider should refrain from giving liquid or food of any kind of the victim or the accident until it is settled that no surgical operations will be required. In case surgery has to be performed, non-complications of this advice tends to complicate anesthesia by inducing vomiting and unnecessary increase the risk of aspiration. Eighth point, observation of surrounding. While the first aid is being given, a survey of scene of accident may lead to identify the conditions reflected to the type as well as the mechanism of injury. The spectators can be able if they have seen the mode of injury or accident. Ninth point, inform relatives and police. If the victim or any of the spectators provide information regarding the victim's identity, the relatives of the victims should be informed. As a rule, in the case of an accident or unnatural misshape, the police should be able to inform immediately. This is the explanation of first aid and the principles of first aid. Thank you.